For example, there's too many outside or exogenous, what economists call exogenous factors that figure into life expectancy. Everything from lifestyle to things like murder rates, suicides, accidents, things where the U.S. leads the world. And these things knock down our life expectancy by comparison to other countries. If you really want to think of, say, well, is life expectancy the measure of a healthcare system? Then how do you explain the fact that people in Utah live 3 years longer than people in Nevada? And they essentially have the same healthcare system. Similarly, one of the things that's used all the time is infant mortality. The U.S. has a much higher infant mortality rate than many countries, and it's suggested that that means we don't have a good healthcare system. But even the organization that collects the data, the Organization for Economic Cooperation and Development, the OECD, says you can't use that data to make comparisons from country to country because the definitions are too different. For example, in the U.S., if a child is born, takes one breath, and dies, it is considered a live birth and becomes part of our infant mortality statistics. In some countries, particularly in Europe, a child can live up to 12 hours, die, and is considered a stillbirth for statistical purposes. It doesn't count in their statistics. Likewise, abortion rates play a tremendous impact. Some countries, problem pregnancies are much more likely to be aborted than in the U.S. For a lot of reasons, both cultural and legal, we tend to not have as many abortions. And in some countries, one of the countries that's cited all the time as having a very low infant mortality rate is Cuba. But problem pregnancies are almost universally aborted in Cuba, which brings down their infant mortality because the child will be born in the U.S. and then die and count in our statistics. So you really can't use those type of measures. I think a much better measure to use is what happens if people are actually sick. What are the outcomes for diseases? And here we know that people from around the world, when they get sick, come to the U.S. for treatment. You know, Silvio Berlusconi, the Italian prime minister, a couple of years ago, he needed heart surgery because, bouncing around with 18-year-old models got a little taxing. And so he needed heart surgery. Where did he go? He didn't stay in an Italian hospital. He didn't go to Canada. He didn't even go down to Cuba with Michael Moore. He went to the Cleveland Clinic in Ohio. And when Beverly Stronach, the Canadian Minister of Human Resources, came down with breast cancer, she got treated at the University of San Francisco Hospital. So people come here when they get sick. And why is that? Because the outcomes for diseases are much better here. Let's take cancer, just one example. British medical journal The Lancet just did a study on 5, 10, 20-year survival rates for all types of cancer combined. For both men and women, the U.S. was number one by a substantial margin over the next highest country. The next highest country was actually different for men and women, but we beat both of them by substantial margins, much higher than many other countries. You can find the same is true for heart disease, AIDS, pneumonia. You can pretty well pick your disease and find that your chances of survival are much better in the United States than they are elsewhere in the world. So I think when it comes down to fixing our healthcare system and the problems in it, we need to be very, very careful that in doing so we don't undermine those things that are good about our healthcare system in terms of innovation, choice, and quality. Now that doesn't mean that we don't have problems with our healthcare system, and I say we do. We have, for example, the most expensive healthcare system in the world. We spend more on healthcare than any other country by a mile. In fact, we spend a third more on healthcare than the next highest spending country, which is France. And we spend about double in this country what the average is for industrialized countries around the world. Now, a small caveat on that. We spend more in this country on everything than anyone else in the world. Well-known fact, we spend double the next highest spending country's expenditures on running shoes. And no one has yet come up to me to complain about the great running shoe crisis facing America. We spend a great deal on healthcare because healthcare is what an economist calls a normal good. And all that means is it's a good on which as incomes rise, expenditures rise. And we are a wealthy nation, and we all want to live forever. So we choose to spend a lot of money on health care as opposed to spending that money on refrigerators or toasters or automobiles or something else. Now, the question then arises, is what we spend too much? Well, that gets a little tougher. We spend about 17.5% of our GDP, our gross domestic product, on health care. Again, far away the highest in the world. And some people suggest that that's too much. To which I reply, fair enough. What's the right amount? Anyone for 16.6% of GDP? How about 15.27? That a good number? Anyone want 14.1? The point is, I haven't a clue. And neither does anyone else. I'm pretty sure we don't want to spend 1% of our GDP on healthcare, like, say, Bangladesh. Nobody's been pushing the Bangladeshi healthcare system recently. But what is the right percentage of GDP that you should spend on healthcare? That's ultimately what markets are all about. They decide how much you want to spend on healthcare versus how much you want to spend on automobiles or toasters or refrigerators or who knows what else. Now, we do have a problem in this country, two problems actually. One is that we don't really have a market in healthcare, so we don't know how much we want to spend. Maybe we're spending too much, maybe we're not spending enough, but we don't know because we don't have a functioning market in healthcare, which is something we need to fix. And second, the distribution of those costs can be a problem because it means that some people can't afford the health care that they need or want. And that's an issue. But that's different than just saying, oh, well, you spend too much. The second problem we have, which is sort of related to that last part, is a problem of access. We simply have too many people in this country who don't have health insurance. Now, you have to be a little bit careful of the numbers. The numbers that are thrown around out there leave a lot to be desired. One of the numbers you hear a lot is that people will say there are 45 million Americans without health insurance, and if you're listening to politicians speak, that will begin to slip up to 46, 47, sometimes it makes 50 million people without health insurance. Well, not quite. The actual number, by the way, from the Census Bureau is 46 million right now, Americans without health insurance. But that's a little bit misleading. For example, of those 46 million, 14 million of them are currently eligible for Medicaid, S-CHIP, or other government programs and have simply not signed up for those programs for one reason or another. In fact, about half were previously enrolled in the programs and dropped out. Now, we can and probably should have a very interesting discussion about whether or not we want to get those people enrolled in the programs and how we should get those folks enrolled in it. But it does raise the question of, do we really need another giant government program to get people to sign up for the giant government program they didn't sign up for the first time?